Hey guys, Dr. Andy here. Today we are going to talk about piriformis syndrome and sciatica. All right, and the reason we're going to talk about that today is because I have had a lot of patients come into my office here recently complaining of low back pain and what they call sciatica. The good news is all of them except for one do not have true sciatica. And I say that is a good thing because sciatica is awful. It's excruciating. It's caused typically by a disc herniation. Therefore, it takes a really long time to fix and to get it to go away. On the other hand, piriformis syndrome, usually what it is actually a pretty quick fix. So we don't want sciatica, and it's a pretty common misconception that any kind of low back pain or any kind of pain in through the butt or even the back of the thigh is sciatica, and I'm here to tell you the good news, it's not. All right, but first, let's tell you what true sciatica is. All right, sciatica is when the sciatic nerve, which is actually coming from your low back, travels all the way down through your butt, the back of the leg, all the way down into your feet. So if you have pain coming from your low back all the way down your leg into your foot, excruciating type pain, it's possible that it is sciatica. All right, so I'm going to show you what this looks like. This is two segments of the lumbar spine, so from your low back. Okay, this would be the front of the vertebra, and this is the back of the vertebra. All right. So if we look at the back of the vertebra, we see these little dangly guys right here. These are actually the lumbar nerves. So the nerves that exit from your spine form the sciatic nerve and then go all the way down your leg. And this white thing you see right here, this is the disc, the spinal disc or the vertebral disc, right? It's shaped like a jelly donut. It's got a hard outer shell with like a jelly liquidy center. And when we have an injury to the outside of that disc, we can have like a little fissure or like a little rip in the outside wall. And when that happens, some of that jelly gets pushed out and it pushes directly towards the nerve, all right, hits it, causes the pain or that true sciatica all the way down the leg. So as I was saying, quite awful. The good news is that's actually very, very rare. A lot of people, they're coming in and they're saying, I've got low back pain and I do have some pain that travels into my butt and into the back of my thigh. All right. This is actually very commonly something called piriformis syndrome. Piriformis muscle sits at the top of your kind of where the top of your pelvis, where your lumbar spine meets your sacrum and your pelvis, and then goes across your butt and attaches towards your hip on the outside. The sciatic nerve sits right underneath it. And so if the muscle, the piriformis muscle itself gets tight, physically it gets too tight because some of the joints maybe down there are a little stiff or not working very well because you've had some kind of an injury either from sitting too much or maybe even a sports injury, it can pinch that nerve a little bit and cause some pain to go down the leg, but it stops at the knee. If it goes below the knee, I get a little bit more worried about true sciatica, but anything above that is sort of like a big whew, like thank goodness it's probably not real sciatica. It's either just something going on in the low back or maybe it's piriformis syndrome, and it's a whole lot easier to fix. So I'm here to tell you the good news is that the vast majority of you do not have true sciatica, but if you have any questions, if you're worried that you have sciatica or if you need a good diagnosis between do I got something going on in my low back or do I have sciatica and what do I do about it, how can I fix this problem because it is excruciating, just let me know, reach out. I'll be happy to answer any questions that you have. So if you like it, share with a friend, comment, like the video. Otherwise, I hope you have a fantastic day. Always remember to live with passion and not pain.